Good morning, everyone. My name is Tracy Mastrangelo. It is my pleasure to welcome you to today's FASD webcast, supporting students with FASD through mentorship, part of a monthly series of webcasts on issues relating to FASD. This webcast is part of FASD Cross-Ministry Committee's initiative and 10-year FASD strategy to provide accessible educational sessions that cover a broad range of topics and that are accessible to all Albertans. For more information about this series, check your emails or our regular updates, or go to hslearningseries.ca, or by following us on Twitter at abhumanservices. You will be able to pose your questions to myself at the end of the session via our live chat window. I will try to address as many of the questions as we can at the end of the presentation. So we will get started. I am Tracy Mastrangelo. Thank you again for joining us. I am the Provincial Coordinator for the Wellness, Resiliency and Partnerships project, which is a project providing success coaches in junior and senior high schools for students diagnosed or suspected of living with an FASD. So this morning, I hope to take you through a little bit of a history. We'll start with some history about RAP so that you have an understanding of where we started and how we started. We'll talk a little bit about the model of the RAP program that we currently are using, and then go into actual RAP and mentorship. The success coach role is a unique role to schools and is different than most of the other education-based roles. So we'll talk a little bit about the success coach role and some of the strategies and tools that success coaches use. I'll wrap it up with some results and data that we've collected most recently in our last school year. I like to start with this quote because this individual was one of our students early on in the project. He was a young man who had a good relationship with his success coach, but felt that I needed to know something as the coordinator of the RAP project in order to take this work further. If you get that warm feeling when you walk in your classroom, where else would you want to go, was what Skylar told me, and it seemed to make sense. What we know is that school really is the place that can nurture success the best for all young people, but it's often in school where a lot of our kids, especially those living with an FASD, experience their greatest failures and have a lot of struggles. In Alberta, in 2009, what was found was that we had really high achievement rates in our achievement, provincial achievement testing. However, across the province, we had reportedly low graduation rates. And so the graduation rates we're looking at, students entering grade 10, only 79.5% of those students were actually completing grade 12 or graduating from high school within 5 years of entering grade 10. And so that's obviously a problem. There's lots of theories and ideas about why this could be, who the population was that were not graduating, were not completing school, although it was 2009 data. So we know that it wasn't because Albertan students not graduating school were going to high-paying jobs within maybe the oil and gas industry. So we were looking a little bit at who was this population. And there was strong suspicion that probably students with an FASD were part of that population. Just given the struggles that students with an FASD have, it kind of fit that these were the kids who were not completing high school within 5 years of entering grade 10. So too often students with FASD face risks of vulnerabilities leading to disengagement in school. And so part of that is, even if they are getting to school, are they actually engaged in the class? Are they able to meet requirements for the course or for the classes in order to achieve and have success for their high school graduation? Students with an FASD, as do all students, are faced with choices and social pressures and peer pressure, and we talk a lot about that with lots of our students, FASD or not, but it seems that our students with an FASD have an actual more struggles in those sorts of areas, and so it made sense that these students were part of that population not completing high school. And so when we talked to teachers and we talked to schools, they identified some reasons that we would associate with the FASD diagnosis as to why these students were not completing high school. So they told us things like mental health problems was a big reason why students were not completing high school. Lots of them were living with a depression or anxiety that was getting in the way of their education and their learning. Disrupted school experiences. It makes sense that these are the kids that we know also are highly represented in our child welfare system, and so sometimes moves were happening and changes in living situations was happening, and so that was disrupting school experiences. Easily victimized. These are the students who seem to be the kids who are in the right place at the wrong time. And that was getting in the way of their education. Maybe there was lots of visits to the principal's office to try and sort out some of these victimization issues. Trouble with the law was another issue that teachers and educators identified, which again fits very, very much with our population with FASD. Inappropriate sexual behavior was getting in the way of learning. Alcohol and drug problems. So this is not new. This is something that we suspected as well to be something of an issue for people with an FASD at times. And so teachers and educators were telling us that they also were finding that this was a problem. And so this was, again, something that was getting in the way of these kiddos being successful in school. Problems with employment and living independently. So definitely the living independently piece. Teachers and educators were telling us that as soon as these kids were turning 18, if they weren't completed high school, they definitely were not going to complete high school. They were kind of going off on their own, and without the structure, they weren't going to complete high school. So we talked to teachers a little bit more and said to them, so what does that mean for you? Teachers told us that it made teaching in their classroom very difficult because they weren't sure the strategies to use. They had strategies to use for students that were diagnosed with an ADHD. They had strategies to use for students with learning disabilities, but they did not know what to do for students with an FASD. In some cases, we even came across educators and schools who said, we're not even really sure what FASD is. What is that anyway? And so with the idea of today's teacher in the classroom trying to cover lots of bases and wear lots of different hats, teachers expressed to us that it was a frustration, that they were concerned. They didn't know how to adequately support these students, and that was leading to disengagement for the students and just leaving the school system. And so in 2009 and 2010, Colleen McClure, who was the then director within Edmonton Public Schools Regional Educational Consulting Services. Colleen was then approached and started looking at how can we actually change this conversation. And so Colleen had conversations with people within education, and she had conversations with grandmothers in northern communities, and the reoccurring theme and the message that she was getting was the message of our kids can be successful if we can just keep them in school. If we can keep them in school and get them through school, then we could actually change the trajectory for some of their lives. And for some of our small communities, which is specifically some people that Colleen had spoken with, that was really impactful because there wasn't a large population, so they needed to have strong community members. So at that point in time was about the same time as the FASD 10-year strategic plan was introduced. And Colleen was approached and asked to look at how could we support students in the education system. It was there in those conversations where the WRAP project, which is Wellness, Resiliency and Partnership, was first born. And so in 2009, 2010, we introduced the WRAP project in schools throughout the province. At that point in time, the idea of coaching or success coaching was just kind of new to our province in the education system. And so with this particular project, we were looking really at three main goals. We were looking at maximizing school engagement. And so we knew that most important is we needed kids not just to be at the school, but to actually be engaged in their learning and engaged in the school environment. The belief really being that if we had kids engaged in the school environment and engaged in their school and in their learning, they were more likely to complete school and they were more likely to graduate within 5 years of entering grade 10. The second goal that we had was very basic. It was to increase academic success. And so again, looking at what were the barriers to academic success for kids with an FASD, for students with an FASD. And again, going back to the information that teachers told us, we knew that it wasn't necessarily just the learning in the classroom. It wasn't just necessarily understanding the mathematics and understanding the readings that they were doing, that it might be other things that were getting in the way of academic success. So that leads us to our third goal, which was enhance social, emotional, and physical well-being. And so we used to talk about in the early days of the WRAP program that this kind of was the catch-all. So we were looking at how do we get social engagement? How do we get these students to connect with their peers or connect with other students? Was that one of the barriers in the way of engagement in the school and academic success? The next was emotional well-being. So knowing that there are often many complex factors related to kids with an FASD, looking at were some of those the impacts on the emotions that these students were having getting in the way, again, of engagement and academic success. And then the last being physical well-being. And so really looking at that, trying to take a holistic approach to the whole child and understanding that exercise and health definitely impacts student engagement and academic success. So we looked initially at wraparound services and used these guiding principles as our initial training for success coaches in the WRAP project. So really looking at, we needed to be team driven, and I think that now we definitely have evidence within the FASD population that working together as a team to support people with an FASD is one of the best practices. So that seemed to fit. Innovative and flexible. We knew that in order to be able to support academic success, we needed that team, whatever that team looked like, to be innovative with the supports that they were going to offer and to be flexible. That not necessarily were the supports going to be needed between 8:30 and 3:30 during those typical school hours. So we needed to be flexible, and we needed to also be flexible about what those services were going to actually be. Community collaboration was our next principle that we looked at, and definitely believed that we needed to collaborate with the community outside of the school, because after 3:30 our students are in the community, and so we need the community to understand and be willing to support just as much as we need schools and educators to understand and be willing to support. Family voice and choice has been has been discussed within lots of the services for people with an FASD as really, really necessary and important for the success. And so understanding that families all have their own struggles, but their own strengths and successes, and their own wishes and dreams for their children. And so being able to really give families a voice and ensure that families are part of the decision making and the choosing and the choices for their students. Supported transitions, and so again, this is very fitting with FASD populations that we needed to support transitions. And so when we talked about supporting transitions, we're talking about little things like in some of our rural communities, we have students who would get on the school bus at home in the morning, ride the school bus into town, and then never make it into the school. And so part of the role was, who can we have standing out, meeting the school bus and entering the school with the students? So we now know that they're in the school. Supported transitions also in a school could look like transitions between one class to another. In our high schools, often the bell rings and students have to move classes. Teachers aren't moving classes. And so often it's in those transitions where there's lots of noise and lots of action and students going and bells ringing and music playing. And so how can we support students to not get overwhelmed in that time frame and make it to their next class? We're also looking at some supported transitions around grade 9 to grade 10. And so often in Alberta, we have a switch of physical schools from grade 9 to grade 10. And we were finding that students with an FASD were completing grade 9, and then they weren't showing up enrolled somewhere in grade 10. And so how could we support that kind of a transition? And then the last principle that we've based the work on is being strength-based. And so really looking at what does that mean? And being able to be a little bit detectives so that we can dig and do some searching to find out what are the strengths. Unfortunately, often these are students who've had lots of struggles through school and often are known to school administrators and principals. And so we tend not to have a strength-based approach. We tend to just see all of the bad things that have happened or all of the struggles that have happened. And so how could we shift that language and shift that focus and become more strength-based for students? So I'm going to talk now a little bit about mentorship and what that means for the RAP project. It's been language that we've used within RAP since the beginning of RAP, is looking at what is mentorship and how are we acting as mentors. Within the RAP project, we really talk about kind of two different pieces of mentorship. So first we talk about formal mentorship within the role of the success coaches, and then we talk about multi-tiered mentorship, and multi-tiered mentorship is within the whole program and the organization. So I'll talk first a little bit about the success coach model as a mentorship model. So when we looked initially at mentorship and what that meant for the RAP project, initially it kind of felt as the success coaches would describe themselves as being professional friends. And so their role in the school was to be friends with the teachers and friends with the administrators and friends with the students. And so, and try to connect all of those pieces. And so we looked at that piece and then we thought, yeah, but it kind of goes a little bit, it's deeper than that, it's deeper than that. And so then we looked at the idea of formal mentorship, informal and formal mentorship. So informal mentorship and formal mentorship, the difference really being that formal mentorship, these are professionals that are in paid positions, have goals and are measuring outcomes. So very similar to an informal mentorship, which would be something more on a volunteer basis, supporting kids or supporting students. So that really, this visual really kind of depicts how coaches see themselves and how they would describe themselves to schools. So the next level of mentorship, or the next approach to mentorship that we talk a lot about within the RAP project, is multi-tiered mentoring. I'm not sure if that's a real mentorship term or if that might be something that we've just invented. But we talk about that success coaches' role is to mentor students. But then success coaches started recognizing in about the second and third year that they actually were also mentoring some of their colleagues that were teachers, and that they were supporting the teaching process and supporting teachers through a mentorship role. Within the organization, we also talk about mentorship amongst coaches. So coaches are mentoring one another. And so we've done that through a few different ways. On Wednesday mornings, our coaches all gather, although they're spread throughout the province, they all gather together on an online forum and have a meeting, and they talk about does anybody have any ideas of what I could do to support this student? We talk about best practices and latest research. And so coaches are mentoring one another in those larger situations. We also ask seasoned coaches to travel across the province to visit with new coaches on site in their schools and to provide mentorship that way. And then we also ask new coaches to go and travel to schools where we've had the RAP project running for a few years so that they can have mentorship that way. Within the project, we have a mentor lead. So we have one of our success coaches whose role is to oversee the mentorship amongst coaches. And so she would be that first call for coaches who say, what should I do about this? This student's about to get suspended. And so she can support coaches that way. As the project coordinator, I'm definitely mentoring the mentor lead as well as the other coaches. And then I receive mentorship from our regional collaborative service delivery manager, as well as school district authorities, cross-ministry committee, and some of our partners within Alberta, like the University of Alberta or Big Brothers Big Sisters. So that's our look at multi-tiered mentoring. I think it's important to note too that what's really exciting, and I'll talk about this later as we move into the results, but one of the things that we found in the last couple of years is that students with an FASD involved in the RAP project are now identifying themselves as mentors to younger students. So I think that that's another level of that multi-tiered mentoring that we could probably add to this visual. So what do success coaches do? So one of the pieces that schools often ask us is, how is this different from other roles in my school? And often it's compared to a role of, like an educational assistant, or I think it used to be called a teacher's assistant. And so people would say, how is this different? Because we're all gearing towards the success for students. And so one of the ways that we describe that and explain that is that from a school perspective, or from an education perspective, educational assistants' focus is curriculum and is supporting the delivery of curriculum, as it is the teacher's role to deliver curriculum. And so looking at how do they support that curriculum, how do they support the students to achieve success with that curriculum, and it tends to be classroom kind of work, education-based, curriculum-based. That's great, and that's very important and very much needed in our school systems. But when we heard from teachers, when we were first starting this project, was that sometimes it's not actually the academic piece or the curriculum or understanding the curriculum that's actually the struggle for these students. Sometimes it's all of the other pieces. It's the life pieces that's the struggle for these students. And so what the success coach does is, the success coach's role is to support all of those external pieces to the education piece that are still getting in the way of the academic success. So really, what we first looked at is providing supports to students diagnosed with an FASD. And so when we very first started this project in 2009 and 2010, that actually ended up being one of our biggest barriers, because a lot of our students weren't diagnosed. And had multiple moves. There might be a note or a query on a file, but that actual referral to a clinic for diagnosis hadn't happened. So then what we started looking at was, how do we actually make those referrals? How do we find the kids that need referrals? And so we broadened our scope and started talking about RAP success coaches providing supports to students diagnosed or suspected of an FASD. And when we said or suspected, we knew that we needed to be cautious about that a suspected student couldn't be suspected through hallway chatter, for lack of a better term, or through this in the staff room chatter saying, you know what, I think this one might have an FASD. We wanted to find something a little more substantial. And so was there documentation? Had there been any assessments that were on the file that would query some of those kinds of things? And so the success coaches really being that information gatherer for students that were suspected of having an FASD, and sometimes success coaches then being the ones that were identifying, this student seems to be struggling in this area, and this area, and this area, and that might be related to an FASD. Maybe we need to talk to the family doctor. So that became part of what success coaches do, and success coaches now in 2016 are working quite closely with their FASD networks and are part of the referral process, and in some cases and in some regions sit in the diagnostic clinics, and then are the support back into the schools to support those transitions back into school after clinic. So initially and still today, we look at coaches providing coaching and goal setting. And so we talk about, as coaches are initially building relationships with students, that they're that little voice on the shoulder that are reminding students of things. So sometimes providing coaching is around social situations, relationships, how to navigate relationships with the adults in the school and also the other students in the school. And so success coaches definitely play a role in coaching those social situations. And then it expands beyond that, because we talked about already that sometimes it's outside of school that kids are struggling. And so I think fondly of a success coach who was coaching her students on safety, community safety, on weekends, on times that they weren't actually in the school. And so she would coach them in the school, they would practice, they would discuss scenarios and how are you going to deal with this. And then it became really exciting when students would come back on Monday and say, hey, guess what? I remembered what you said on Saturday, and when I was faced with this situation, I did exactly what we practiced, and it worked out great. Goal setting was another area that we've looked at closely, and so really, again, this needed to be driven from the students, and this is where family voice and choice definitely played into that. And so looking at what were goals that were achievable for students, and how could we take those goals and break them down into smaller, more manageable goals, so that students were able to actually achieve them and then experience some success. So coaches used all kinds of tools. Sometimes goal setting, students might say, my goal in grade 10 is to graduate high school. That's a great goal, and we would hope that that's the goal for all grade 10 students. But we needed to break that down a little bit more. Okay, so how are we actually going to achieve that? Well, we need to actually come to classes. Okay, how are we going to achieve that? And so breaking those goals down into smaller, more manageable pieces, and then celebrating those goals. That was the really big pieces that coaches have gotten to do over the years, is celebrate when students have actually achieved success. The other piece would be really those less structured times and providing supports for students during those less structured times. again, if our goal is to complete math in grade 10, and math happens to be in the block right after lunch, we needed to find ways to support students during lunch break so that they could get back to math class. I used to joke that when I was a success coach that I needed to actually have my office based at the local shopping mall, because my students would go over there at break and there was no bells attached to the shopping mall. So students didn't know when to come back. So how could we provide some structure and some strategies? So that looks like lots of different ways that coaches are doing things, groups or jobs for students, all kinds of things. Supporting students' families, schools, staff, and community partners in a collaborative wraparound service. And so really the wraparound service, again, being those principles that we talked about at the beginning. And so how do we give families voice and choice? How do we actually build teams around students for success? And then not just build those teams, but then how do we support those teams? Because this is hard work. And parenting youth with an FASD is hard work. So how do we provide supports to families and provide supports to school staff so that ultimately they can be supporting students and we can see some achievement and success? So that's really kind of the overall kind of bigger picture of what success coaches are doing in our schools. Definitely the role has grown and developed through the years, but I think that's kind of the overall. And it was going to look slightly different based on personalities of success coaches and the needs of the communities and the students that they're supporting. So this is just a little bit of where we've been and where coaches have been placed. Initially, when we started the project funded the cost of the coaches, but one of the things that we found was really important was that coaches were actually employees of the school district. And so we would enter into partnerships with school districts so that they were actually employing the success coach, and the success coach was then seen by the staff as another staff within the school. Where we've gone to now is that success coaches currently, it is a cost share arrangement between the WRAP project and school districts. And so we both cover the costs for success coaches. We share the responsibilities around professional development for success coaches. And then we also work collaboratively as far as supervision for success coaches. And so WRAP's piece of that often is mentorship, but we definitely work very closely together with schools around that. We do have some situations. We've got 2 examples of how success coaches are paid that is beyond that. So we have one FASD network in the province that funds their success coach and then shares that success coach with the 2 school divisions in their community. We have another example of an FASD network that has entered a 3-way partnership with the WRAP project and the school division. And so that FASD network is paying 1/3 of the cost for 2 of their success coaches in their region. So I think some creative ways for how we're spreading success coaches across the province and how we're able to utilize this model across the province. So we'll talk a little bit now about the success coach toolkit, and so what are our success coaches doing. So when we look at how can success coaches best support students, the teams supporting the students, and the schools, we looked really at breaking it into those 3 levels. And so we were looking at building student capacity, building team capacity, and building system capacity. We knew that in order for students to achieve and experience success, that they needed to have some capacity built. They needed to learn how to organize and have some strategies and supports put in place for simple organization. They needed to be able to have whatever supports they needed in the classroom to actually experience success. So maybe it's a technological device, maybe it's having somebody reading the assignments or the exams to them. And so we needed to look at what were the supports that we needed to put in place so that students had the tools that they needed to be successful. And so sometimes that was really creative things like success coaches carry cell phones, as do most of our students. And so sometimes it was student capacity building, in order for a student to be successful, we needed a success coach to be able to call in the morning and say, hey, listen, class is about to start, you need to get to school now. So those kinds of supports, sometimes it was even, programming alarms into students' phones so that students knew, had a guide and a reminder as to get up in the morning, or a guide and reminder as to where they needed to go for the next part of the day. So building student capacity really was based on that relationship that students and the success coaches build together. We next looked at the team capacity building, and so that team we knew needed to be close and connected around the student, and needed to understand FASD, needed to understand the strengths for the student, and needed to understand the challenges and how we might best support that. So we looked at some actual data that suggested that every student needs a minimum of 5 caring adults in their lives to experience success. So success coaches then were tasked with go out and find these caring adults. They're going to be in the school, they're going to be in the community, they're going to be at home. And how can we then support the capacity of those caring adults to support our students? And then system capacity building, looking at the overall system of education, and how do we, within schools, support students. So we've used lots of different things in lots of different ways to do that. Definitely within a system, if we're going to support students with an FASD, we need to understand students with an FASD. So success coaches have been asked to go out into their schools and provide professional development to teachers and educators. So we'll look a little more in depth of those 3 different capacity building areas. So student capacity building really was the coaches mentoring and coaching students, informal goal setting. So really, again, as we talked about, breaking down that goal setting, supporting students during transitions. So success coaches were setting students up so that they had things to do at lunch breaks, so that they were staying at the school and actually making it to the next class. Supporting students, so maybe students struggled with getting from one class to the next during that 5-minute break between classes, and so coaches were then looking at how do we support that? So it might look like teaming that student up with another student and saying, okay, you guys walk together to that class. Sometimes it was other things that we needed to put into place. Sometimes it's just the busyness of hallways and the noise that was overwhelming for some of our students with an FASD, and that's what was creating barriers for them to make it to the next class. So we would find ways around that. Maybe we would transition them before the bell rang so that they were at their next class before all of the craziness in the hallways happened. Or maybe we held them back in their first class and then transitioned them once the hallways were clear. And so it really required communication amongst the team, amongst the teachers, so that everybody kind of knew what was going on. And then providing supportive attendance in school. So providing ways to actually get students to school. So like I talked about, sometimes it's just that phone call reminder in the morning. Sometimes our families our families struggle with this, right? And whatever's going on in the family or in the home, the idea of calling in the school to say my child's going to be absent today wasn't something that families were necessarily comfortable with. And so then that required coaches to build relationships with families so that maybe the coach was the one that was getting the phone call from mom or dad saying, little Johnny's not going to make it to school today. We also looked at how do we provide some strategies for less structured parts of the day. And so often our less structured parts of the day are after school. And so what could we do, or what supports could we get put in place for students so that they had some sort of structure throughout their day? So that looked like getting them involved in extracurricular activities in their schools or in their communities that they could be involved in. I think of the one coach who was based in central Alberta, and she used to help organize school dances so that she would be there, so that would support her students to get there. So it's kind of finding some creative ways to support that capacity for students so that they can experience that success. And then if we look at building team capacity, so again, the team being the minimum of 5 caring adults surrounded by the student, we knew that one of the key aspects of team capacity was going to be that the team actually understood the diagnosis, understood if there was a diagnosis or if there was a suspicion of an FASD, understood what that meant. And so that, we needed to talk about the brain, and we need to talk about how the brain was wired. And that's where organizations like Professionals Without Parachutes came in, because we now have tools to support team capacity in those areas. We can say, hey, watch these videos. So really it was looking initially at how do we help people understand. So success coaches have been very, very creative in this way. So sometimes it was looking at handouts and leaving little notes in schools, in teachers' mailboxes, so that they knew, here's an FASD tip. Hey, did you know this about FASD? One of our success coaches found that she kind of struggled with that, because in the morning she'd go to all this effort and put these notices in everybody's mailbox, and the next day she'd find them in the recycling bin. So she was a little disheartened. And so she thought, what could I do? What could I do? So she started actually printing off just a few and hanging them in the bathroom stalls of the teacher's staff room. And thought, well, I'll just try this and see how that works. And after about 3 weeks, she had some teachers come to her and say, hey, it's time to change the reading. Could we get a new sheet in our stall, because we've read that one already, we get it. So that introduced the idea of what the coaches now call Biffy News. So if you go to any school in the province of Alberta that has a RAP success coach, if you look in the bathroom stall, that's likely where you're going to find some news on and information on FASD. But we found that it worked. So it was an innovative strategy that we needed to find a way to make it work, and we saved a few trees in the process. We needed to also look at how were we supporting the community to understand FASD. And so when we're looking at transitioning, when we transition out of high school, how are we going to support the community then to support these kids? How are we going to support the community to hire these kids and work with these kids? So we have success coaches then doing a lot of work with businesses in their communities to understand FASD, setting students up with work experience class so that the students can then get credits for work experience towards graduation, but they can also then get a job and potentially transition. And so we had success coaches working really closely with their communities around supporting that piece. We also have coaches working closely, all coaches are working closely with their FASD networks and the other FASD related services in their community so that they can make appropriate and timely referrals for students. We have coaches across the province who provide FASD information to other students in the school. And so one of the ways that we've seen that happen often is in comm classes. Actually, I think that this morning I have a couple of coaches who are presenting to a comm class in Slave Lake. So that's exciting news. We now have students understanding one another, and hopefully we're doing some prevention of FASD. And then the other piece is RAP resources. And so coaches have developed all kinds of resources that will support students and support teachers and families, whether it's a checklist of strategies that we've tried and strategies that have worked, or maybe it's a printout of understanding what executive functioning actually means. And then we needed to look at a whole overall, because it's not just about the teachers that the student specifically is in the classroom of, but other teachers as well. So how do we build capacity within the system? And we still do presentations to school staff. Often we're called in on PD days to present to school staff or district staff. It seemed that we also needed to look at some of the other school staff. And so we talk a lot about teachers and administration and the educational side of it. But we also needed people within the school like secretaries or our janitorial staff to understand the disability as well, because sometimes they also are involved, right? It's the school secretary who's taking the phone call, or it's the school secretary who's seeing the student during their trips down to visit the principal. So we needed everybody to have an understanding. And so success coaches are working hard to do that. We've built partnerships with Professionals Without Parachutes so that we can use those resources, and we provide those kinds of supports and services to schools. Partnerships with diagnostic clinics that I've talked about. We have one success coach that is we've now moved into a position called Transition Success Coach, and her role is directly connected to the Glenrose Hospital. So she is receiving referrals from Glenrose Diagnostic Clinic to support students with an FASD in their schools. And so she's supporting that transition post-clinic back into schools, and supporting then the team as to how can we do that. One of the things that we needed to look at is suspension alternatives, because the suspension rates for this population were very, very high. So how can we actually find other ways to discipline or deal with situations other than suspension? So success coaches have been trained and are all trained in restorative culture and understanding restorative culture, and have then brought that information back to schools and are introducing restorative culture right from circles in the classroom to being a relationship builder to restorative practices to be used instead of or in the place of suspension or expulsion. RAP has developed a website. It is www.rapschools.ca. I think that's it, I'm pretty sure. rapschools.ca, and so on that website we're in the process, I think we're actually just in the process of rebuilding it. We're putting some more resources on it, but lots of resources for educators and school administration about how do we actually support kids with an FASD. What do we do now what do we do if we have a student that we suspect has an FASD? How can we go through that referral process? And what do we do after that referral process and after that clinic, that diagnostic process? I am going to zip by that for time's sake. So the other thing that RAP coaches have done is RAP coaches have created an app, the RAP app. And so this was intended to move away from the idea of big binders on teachers' desks. So what's something quick and easy that teachers can access? I need some quick FASD information. I need to have a quick strategy. What can I do? Most of us these days carry those cell phones around, and so we looked at how could we create an app that would be a resource. So that can be found on iPhones, and it is, if you just do the search for RAP app or RAP FASD. Another innovative thing that success coaches have done is looking at 8 magic keys. And so 8 magic keys was developed by Jan Lutke and Deb Evanson. And it was really looking at what are the 8 magic, what's the magic recipe for success for students with an FASD. And so some great resources that Deb and Jan had created, and RAP success coaches have taken those and made them into really short, quick, but concise YouTube videos that again are accessible through the RAP app as well as through the website and on our YouTube channel. And so really it's a 3 minutes, so we can say, you know what, structure is really important for people with an FASD. Here's a quick video that talks about that and talks about ways that we can incorporate structure into our classrooms. So just examples of a great strategy or great innovative things that coaches have created. The coaches actually have also identified that it was really important. We have actually added a 9th magic key, which is teamwork, because we again know that it's important for all people with an FASD to have a supportive team around them. So coaches have created another one. And then when we're looking at executive functioning supports for students with an FASD, coaches have done all kinds of things, but really looking at things like providing leadership opportunities for students who otherwise wouldn't be seen as leaders in their schools. Teaching students some stress reduction and looking at some of the research around mindfulness and applying it to students with an FASD. How can we support that? Teaching students themselves about brain development, about how their brains are wired, and what makes their brains really remarkable and exciting, and what's some areas that we can put some supports in place so that they have some less struggles and frustrations. And then finding all kinds of, testing all of these strategies and all these tools, and then finding the ones that work, and then sharing those with teachers and EAs. So really recognizing that we need to make lots of attempts so that we can find the right strategy, and sometimes on the fly in a classroom our teachers and EAs don't have those opportunities to do that, so success coaches are doing it. Finding, you know, really it might be something as simple as music, and so maybe that's an anxiety reducer for a certain student, or maybe it's going to help one student focus when they're trying to write an exam or read a story. So using some strategies and supports like that and putting them into place. So I just want to talk in the last 10 minutes here about our measurement. And so one of the things that RAP has done from the very beginning of the program is collected data on our students. And so we've looked at some basic data. What we really want to know is how do we measure success for these students? So initially and still to today, we have collected data in 5 subjects. So we collect data in math, language arts, social, science, and then phys ed as well. So phys ed really trying to capture that physical well-being piece for students. So looking at also diagnosis versus suspected, ages of students, and family involvement. So this is recent, this is hot off the press that has just been being released right as we speak to our school partners and our funders. So last year, so in our last school year, we worked with a total of 254 students in 39 schools with the RAP project. One of the things that we've done is we've introduced through partnership with J. Percy Page School in the Mill Woods area and the catchment that they have in the Mill Woods area. We have partnered with them to introduce what we refer to as RAP 2.0, so the next version of RAP really. And RAP 2.0 is funded by that school catchment. It's not funded by the RAP project, but we support the success coach and the schools through involvement in our community of practice and our multi-tiered mentorship model. So RAP 2.0 is really looking at students that are considered vulnerable. So identifying that we've had success with students that are diagnosed or suspected of FASD, but looking a little bit deeper, a little bit further and saying, hey, would this work for students who are immigrant or refugee? Would this work for students who have struggles with mental health? And so we've had 76 students introduced to RAP 2.0 last year. We had 14 students that were supported through a partnership that we did with Foothills Fetal Alcohol Society last year, looking at that, supporting those transitions from clinic back into schools. We had 12 students supported last year through our Glenrose position, so the transition success coach that was supporting the transition of students from the Glenrose Diagnostic Clinic. And then we had 152 students in the traditional RAP model. So really exciting, just looking at this bar graph, really exciting piece that we love is looking at that jump and the number of students that we have involved in the RAP project last year in grade 10. It's significantly higher than any of the other grades, and that really tells us that we're making some strides and some success in transitioning students from grade 9 to grade 10. So that's exciting. And the other thing that's really exciting for us is that we actually have a pretty significant number of students in grade 12 involved in the RAP project. Again, this would not have been similar data that we would have collected in our first year. We had very low numbers in grade 12, so we're excited to see that number's up. This bar graph is just looking at our data here as far as confirmed, suspected, or assessment pending. And so again, this is exciting because when we first started with the RAP project, our confirmed numbers were significantly lower than suspected and assessment pending. And so it's exciting to see as a whole FASD initiative that we're actually getting more diagnoses in our schools, and students can then receive the appropriate supports. So one of the things that we did in our data collection this year is we actually surveyed our students. It was a difficult process. Coaches started quite early on in the year to gather that information with some of their students that they'd been working with for years. But we wanted to hear back from the students. We wanted to know, is this working for you? We think it's working. We're attributing the successes with your school achievement to be working. We're attributing it to the success coach. Is it working for you? And so really exciting that we have so many students who are saying, I look forward to seeing my coach. That's exciting. So there's a lot of research and articles that suggest that it just takes one caring adult in a school to make a difference for a student. And so that students are identifying that their coach, they care about their coach and that they actually look forward to seeing their coach, attributes to maybe why they're coming to school every day. So that's exciting news. Some other information that we had was that 97% of our parents and caregivers were in regular contact with RAP coaches last year. That's exciting. These are families who have lots of struggles. Caring for somebody with an FASD in your home is not an easy process. We have lots of professionals involved, but to have regular contact with a RAP coach at the rate of 97% is fabulous. 93% of our parents that were surveyed said that they had received FASD information from their RAP coach. So again, looking at how do we build capacity in that team around our students with an FASD, that's pretty significant. We had over 80% of our students in the last school year that did not receive a suspension. That's astronomical because these are the kids who were receiving regular suspensions and some even expulsions. And actually last year we didn't have any expulsions with the students that we worked with, which again is rare. So we're really excited about that. And then our numbers of 1 suspension or 2 or more suspensions is also significantly low. It's less than 10%. So that's exciting. Here's our data on course completion rates, and so we ask coaches to identify, we don't separate what level of course they're in or what kind of supports were put in place. What we're really just looking at is course completion rates, and we have very high. Math is just over 90% course completion rate, and considering that this is a population that often struggles with mathematics, that's really incredible that we have students that are completing their math requirements. It's a requirement for graduation. In the early days of the RAP project, we would actually see English, math, social studies, and science significantly lower, and we would see phys ed very, very high. So it's really nice to see them quite a bit more even and very closely comparable to one another. And again, we don't attribute this specifically just to the success coaches, but we do attribute it to the teams that they've been able to create, and we do attribute it to the role, having them in the schools. So it's incredible data. This was looking at the next level of mentorship. And so we actually have students identifying themselves as mentors now. And that's pretty exciting that we can now have students with an FASD in our schools seeing themselves as giving back and seeing themselves as role models in their school and wanting to do that. Considering the statistics and information that we know around the relationship between an FASD diagnosis and diagnosis around of things like anxiety or depression, it's really exciting to see that so many of the students involved in the project last year identified that they like themselves. The have a job would be the only area that we had disagree, and we thought that was probably okay because they're meant to be in school right now. But there was incredible stuff there. 58% of our students were engaged in extracurricular activities last year, so that did not include employment, but maybe involved to a sports team, or were doing some sort of volunteering after school, or had a club or a group to go to after school. And 88% of our students reported that they strongly agreed that they got along with teachers. And so if we're trying to reduce barriers for support and success for these students, that's a really important number to look at. So wrapping it all up, success coaches are vulnerable mentors, are formal mentors for vulnerable students. And so in this next year, one of the things that we're going to actually look at is that we know that success coaches are supporting more than just the students with FASD in their schools. And we want to capture that piece too. Right now we only collect the information and data on students with an FASD or suspected of an FASD, but we know that coaches are mentoring other students as well. Our success coaches are supporting success and goal achievement, and the basis that they do this is through relationship. They are building relationships with their students, they're building relationships with their school administration, teachers, caregivers, and then community supports as well. So they need to do that in order to build those circles of support. So now we have students who are supported not just in school, but in the community as well, which makes those transitions, whether it's just a transition from school, after school to home, or it's a transition from graduation into adulthood, those circles of support are necessary. And so coaches are integral in building those. And I mean, the data speaks for itself, but through the innovative and strength-based supports that coaches are leading the way with creating for students with an FASD, our students are experiencing success. And that is that's the information that just gives me goosebumps, because I think so many of these kids haven't experienced success yet in their lives and don't know what it feels like. And so that they are experiencing success and can continue to experience success is really exciting. And we know that now that schools are utilizing. We have schools in some school districts who are now hiring their own RAP success coaches and are saying, hey, this model works really well with our students with an FASD in high school and our vulnerable students in high school. I bet you it could also work with our elementary schools as well. And so moving those success coaches into elementary schools. So as far as capacity building, that would be our key. I've just I'll put up my email address, and I apologize because it's kind of ugly and green, but it's tmastrangelo@gsacrd.ab.ca. Or you can access me through rapschools.ca. The website might be momentarily down, as I know that they were working on it yesterday, but it will be up within a couple of days. So if there's any information that you want and are looking for more specifically, I'm happy to share it, and send me an email. So that concludes the presentation. Thank you for listening through all of that, and we've got some time now for questions.
Yeah, first I'd just like to thank everyone and all our viewers for their patience while we work through those technical problems at the beginning of the webcast. Just so everybody knows, the full webcast will be viewable, including the 2 minutes that were cut off, on hslearningseries.ca in about 2 weeks from today. We have had some questions come in via email, and we'll address those now, but the chat function is back up and working, so if you have any new questions, please type them into the chat function. So we'll start with this question. Does the program have data on what the average cost of the RAP services coaches are per student?
Per student? No, but I think that we could definitely look at that. And if whoever sent that in would like to email me directly, I'm more than willing to talk about our cost share setup and how we've been looking at it.
Okay. The next question is RAP in elementary schools?
The traditional form of RAP is not actually in elementary schools. Our focus has been junior and senior high schools, and the reason being is that traditionally our traditional modes of support for students, for all students, works for kids with FASD in our elementary schools. So using an educational assistant and some of our other universal supports that we put in place for all students work for students with an FASD in elementary school. So we see, we tend to see less struggles. There are 2 exceptions to not being in elementary schools. The first being RAP 2.0. So that particular program or offshoot of the RAP program. We do have RAP success coaches, or RAP 2.0 success coaches in, I believe, 5 elementary schools in Edmonton area. And then the other exception to that rule would be our Glenrose transition success coach, who is transitioning children or youth from the Glenrose Diagnostic Clinic back into schools, and so often that is in elementary schools.
Next question is, how do we get a RAP success coach?
Oh, good question. I mean, funding your own RAP success coach, as Edmonton Public has done in a few instances, is always an option. But if somebody's interested in building a partnership to have a RAP success coach, I would invite you to email me, and I'd love to have that conversation with you.
And the next question is, how many schools is RAP in?
Last year, RAP was in 39 schools, and we are just, with the school year just starting, we're just getting up and running now, but we anticipate this year to be around 45 schools this year.
And that's all the questions that we have.
Great. Great, thank you. Thank you again for joining us today. Stay tuned for information on our next season of FASD webcasts, our next sessions. To get updates and registration information about each of the sessions, please email us at fasd@gov.ab.ca and ask to be added to our mailing list. You can also find past and future webcasts at http://fasd.alberta.ca or sign up at http://hslearningseries.ca. Today's webcast, as previously mentioned, was recorded and the video will be posted online along with videos from all other previous webcasts. The video link will be sent out to all registrants in the near future. We encourage you to share this video with anyone you think may be interested. If you have feedback about today's webcast, please email us at fasd@gov.ab.ca and let us know. You will also be receiving a feedback email from us. Please take the time to let us know what you think of today's webcast. We'd love to hear your ideas. Have a wonderful morning and a good afternoon, and we hope to see you next time.